You're listening to the Beauty Beyond Bella podcast, powered by Formula Wellness.
I'm your host, Dr. Yvette Suarez, owner and medical director of Bella Excellence, a diamond-accredited anti-aging med spa in the Tampa Bay, Florida area. On this show, we explore the latest trends in health, beauty, and anti-aging medicine while celebrating the inspiring journeys and achievements of our guests.
Well, welcome to the Beauty Beyond Bella podcast. Today, I have our lovely Dr. Jennifer Walden, who actually did her fellowship in aesthetic plastic surgery, has multiple locations in the Austin, Texas area. So, welcome.
Thank you. Thank you for having me.
Yeah, look, this is lovely. Dr. Walden is one of our partners for Formula Wellness, and we're going to kind of walk you through multiple questions that think you would have in both the aesthetic field, wellness field, and then plastic surgery.
Sure.
So I would love to start with a question that I get all the time, and I think my patients get a little frustrated. They think that once they have plastic surgery, like a facelift, that they will never need Botox again, that they will never need fillers again. Can you walk us through that process?
Sure. I mean, a lot of times patients are getting, from their 30s on, they're getting Botox and filler, and then there gets to be a time that you reach where you hit a brick wall, and Botox and filler they're never going to lift the face, right? So, or cure your platysma bands. So that's when you get referred to a plastic surgeon like myself. We do that surgery, but if you can imagine, we're kind of addressing the structure of the face, the SMAS, or the underlying foundation of the face, the platysma muscle. But we don't take away the fact of maintenance, right? So it's like buying a new car. You can buy a Mercedes, but Mercedes still wants you to service it every 6 months. It's a beautiful car, whatever, great build, everything, but you still have to service it and maintenance. And so once you get a facelift, you age, from that point forward. We may set you back 8 years with surgery or something like that, 5, 8 years, but you still have to go in and get like laser resurfacing or chemical peels. When we do a facelift, we're not really addressing right here, the 11, so you're still going to need Botox there. You may not need Botox in your platysma bands like I do right this moment in time, but we still are going to have to do maintenance on you. And that's where I think sometimes, mea culpa, sometimes plastic surgeons themselves may not explain that quite as elaborately as a patient needs to understand that, and sometimes patients maybe don't hear that, and that's the case with a lot of people.
Yeah, I think they literally come in and they think it's a one-time procedure that will last them the rest of their lives. And like you were just saying, it could be only 5 years, 7 years, 8 years. It's really not a full time. We continue to age every day. We continue to lose collagen. And
That's right.
so I always tell my patients, the more you can do preventively before you need plastic surgery, right? Because you don't want to have it done multiple times in your lifetime. And I love that talked about the glabella lines. I think people don't understand. For me, when I look at plastic surgery, and I think of facelifts, right? Particularly when they have lots of jowling, lots of hanging skin. It's really that the skin is so much bigger than what the structure underneath is that requires the need for a lift, right? But it doesn't change movement. So you still need a tox to maintain it. It doesn't necessarily volumize long term. And so I know that many times you'll do either, maybe some fat in their injections or then fillers later on. Is that a true concept that patients, I think, are a little bit misconceived, that they think it's a one and done?
Yeah, I mean, I think basically, everybody's individual anatomy varies in their own genetics. And so your environment, your genetics, how you treat your skin, how you treat yourself, your stress level, those things all affect aging. And so aging just marches on. We can set that clock back to a certain time point, but aging and those whole processes are gonna live on. A good example is like when we do a facelift, we do fat grafting to the nasolabial folds, okay, or the lips. But fat's your own body. It's great. It's a great resource to use during a facelift because you're under anesthesia. So we can do a little lipo down here, which no woman ever said not to lipo or tummy. And so it's a great thing, but it fades away. And I tell my patients that, you may have 50% left by about a year. And so I say, at that point, we may take a filler off the shelf to redo your lips if you liked them done. If you thought they were too big, we don't have to do that again. in. But, we may take a Botox and we may get your crow's feet. Although they may be ablated somewhat with a facelift or a brow lift, we still are going to need to do that. And we write that down and we tell patients about that. I think some of it, just to be very frank with the audience, is some of it is the investment that they make, and as you know, a lot of things about aesthetics is financial, and so some patients should have a large, they have a hard time swallowing the fact that they've, doctor, I've just paid X $1,000 for a facelift. How come I don't have my lips anymore? How come I don't have the? And so a lot of our expectations, as in any type of medicine, is preoperative elaboration and informed consent and going over expectations and saying these things out loud ahead of time, so that when it comes time a year later and I say, I think you might look better if we do a little Botox here because the brow is higher, or we do some more filler. It's not like, oh my God, I just spent $20,000 on a facelift. Are you kidding me? And we're not at that impasse in the relationship. So a lot of it is preoperative education about expectations going forward.
Yeah, I completely agree. If they don't know what to expect, they're going to be really disheartened when they come in and they have to spend some more money. But
Yeah.
I love that. And at your practice, because you also have the med spa, you do a lot of preventative things like lasers and stuff. What is your favorite, and what do you think people should, kind of routine should they have?
I guess I think Botox or neurotoxins or neuromodulators are a great starting point for anyone. Dermal fillers, I wouldn't, I would use them judiciously. So I always tell patients, don't just load filler in your face year in, year out. There's an art to it and a science, as you know. And so while I recommend dermal filler, I won't recommend it anytime within 12 months before a facelift, because we're just going to be, I'm just going to be seeing that in the dissection, which makes visualization harder, or dissolving it ahead of time. But otherwise, preventatively, I like, neuromodulators. I think laser resurfacing every couple of years or something like that. Broadband light or IPL once a year or twice a year. I like soft wave, non-invasive ultrasound for just soft tissue lifting. So, I've gotten a couple of those, but I'm not going to do any more because eventually I want to get a facelift and I don't want tissue planes fused together or anything like that. So energy-based devices are good, but to use them over and over again and expect them to lift your face is a fallacy. And it also makes it very harder for the plastic surgeon when they go in to lift your face. It's going to make it harder on a dissection.
Yeah, that's interesting because we are trying to do everything we can, right? Truly, before we need a facelift and be cut, just for risks of scarring, or you may not like it, or even just financial, right? But everything kind of costs money. So I agree. Like it's interesting. We do all these things. We do everything we can to build, collagen stimulation, whether it's an ultrasound machine like all therapy, a
Right.
laser technique, Sculptra, hyperdilute radius. We're always doing things to build collagen, right?
Oh,
Isn't that what we want? I mean, I know that if I try to put a cannula in my face, it gets stuck, right? I have
yeah,
so
yeah.
much collagen being
Me
built. I
too.
am never going to
Me
be a
too.
good candidate. You're going to kick me out of the
Oh,
OR and say,
yeah.
forget it, you're too
Yeah.
difficult. But
That's
that's kind
it.
of what we do, right? We're trying to, I think, eliminate the need for a facelift, or at least postpone it much later on in life.
Yeah, I think we are, and I think there's a certain amount of we always go through this zealot curve with. I think the zealot curve of non-invasive and that can do is coming down a little bit to the normative, right? Because we
Hmm.
now see we see an uptick in facelifting just because we see so many people getting, like, whatever, Lindsay Lohan, Kris Jenner. We see the world getting a facelift and it looks great. It doesn't look unnatural anymore, right? And so our techniques have improved, but I also think patients are getting more educated, and I think the layperson now understands there is more of a limitation to what they can do. It's not all of the non-invasive is not going to lift the face. At some point you'll probably need a surgical procedure if you have the downtime and finances to do that.
Yeah. It's all about education and telling our patients that you're going to get a 10% approval, 20%, 30%, depending on what you're looking like. And it's more soft tissue lifting and more of that epidermis and dermal layer that we're really working on in the aesthetic part, right, in your med spa, and then the really deep resurfacing smash part in the actual plastic surgery. So
Correct.
if my patients they think about having plastic surgery, for me, and you can tell me what you would recommend, I normally have them stop doing tox at least 6 months prior and fillers at least a year prior. Is there anything else that you would prefer for your patients?
No, I think those are good guidelines for energy-based devices like radio frequency or cool sculpting. If you think you're going to, I would say if you think you're going to get a facelift in the next 18 months, I wouldn't do any of those. If you thought you're going to get a facelift within the next 2 years, I wouldn't do a thread lift and get PDO threads shoved into your face. Although I do thread lifts, right? And I've had one myself. You still wouldn't want to disrupt the tissue planes and cause inflammation and scarring. Same with Sculptra. I probably wouldn't do Sculptra within 18 months of a facelift because it does cause an inflammatory response. But there are things you can do. Like you can do a laser procedure. We do laser procedures at the same time. You can do chemical peels, all that good stuff. So there are things you can do, and I'll clear my patients to do them. Do they want a BBL a month before a facelift? Sure, that's all fine. But those are addressing like the superficial, like vascularity and pigment and fine lines and wrinkles.
So let's talk about your med spa side and the wellness side. So you don't really see a lot of plastic surgeons that are really going into the wellness component and how important that is for patients. Tell me a little bit about your bioidentical hormones and why did you incorporate wellness into your aesthetics?
Yeah, so we actually incorporated bioidentical hormones into my practice probably about like, gosh, 7, 8 years ago, a long time ago. And then, when the peptides and semaglutide came around, we incorporated that. But it's within the walls of my plastic surgery clinic. And while I learned about it and was very intrigued by it, my wheelhouse is plastic surgery. So I always was learning from my nurse practitioners. They were teaching me, and I was going to seminars. So that's when I really, I got to the point where I saw this real big boom in like the weight loss, medical weight loss, semaglutide, and I ended up partnering with Formula Wellness. Fast forward, they own the medical spa part of my practice now, but that was a good move for me because that's what they do best. Like, well, I know aesthetics best. They know wellness best. And so I got to the point where there are people lined up out at my surgery center to get their semaglutide, and I couldn't even ask my surgical coordinator who's on first next, because they were like giving out medicines. It was such a big boon to the practice. So I needed to almost outsource that and get someone who kind of is more in the medical realm managing that. And so that's why I partnered with Formula Wellness, and that's what they specialize on. So my medical spas now have a very strong component of wellness to them. But the beginning of that narrative was about 8 years ago when I started. It just continued to grow, and then it grew outside the confines of a plastic surgeon practice. And what can a plastic surgeon kind of actually make a statement on, like, so. And that's why, like, say Dr. Brian Redman, if my nurse practitioner has a real deep question about like peptide physiology and internal medicine, she's going to ask Dr. Redman. But if there's an aesthetic question or a patient that's wondering about how does semaglutide affect future facelifting or due to the collagen, they're gonna come to me for that issue. And so that's why that works for us.
Yeah, look, I think that should work for most people. I really truly am on that mindset that everything is a combination, right? Feeling good inside and out. I think I tell my patients all the time that it's easier for me aesthetically to make you feel and look your best, right? And go out feeling confident, but
Yeah.
to make you feel internally well, that becomes a conversation. You and I have to have a game plan together and
Yeah.
strategize. You need to put in more than 50% of the work when it comes to your
Yeah.
internal being.
That's right.
But I love that you incorporate that into, even though it's part of your med spa, that it's part of your plastic surgery concept, right? To feel good inside and out.
The Formula Wellness 4 cornerstones are nutrition, functional wellness, aesthetics, and brain health. These serve as a guide rail for individuals that are pursuing longevity inside and out. Formula Wellness is setting the new benchmark in preventative healthcare and aesthetics. Thank you for all of your support. To learn more, please visit www.formulawellness.com. formulawellness.com.
So we were just talking about how wellness is really important. It's interesting, when people come in, that they care only about the aesthetics originally. They're like, okay, I know that decreased estrogen causes wrinkles and decreased testosterone causes cellulite. And I go, well, it also causes heart disease and high cholesterol and high blood pressure. But they really come in for the aesthetic part of it, right? And so you've kind of blended that into your practice, which I really absolutely love.
Yeah, and I didn't start out actually thinking I was going to provide wellness and medical weight loss and sexual wellness component, but those things are so synergistic with what we do. Our patients started to ask for it. And so that's when I started to grow that side of my practice. So now the surgery center and the medical spa are very, we kind of work together and synergize on, and we create specials, but we constantly are referring back and forth because the patients not only want to look good on the outside, but they want to look good on the inside. And like you said,
Yes.
I think that's a lot harder because the patients themselves have to invest themselves in it, 24/7.
Yeah, absolutely. And so your nurse practitioners now are even doing, not only they're doing weight loss, but you talked a little bit about them doing peptides and all the hormones. So there really is like a full wellness program that's really helping your patients move to the next phase, right? And also maintain our youth. I really think that the better we feel inside, and if we get a good gut and everything else, we actually glow more on the
Oh,
outside.
for sure. Yeah, I think for sure we are able to do more, be there more for our children when we're less fatigued, when we have more energy, we have more libido. You're going to have a happier sex life. There's just no doubt about it. And when you have a happier sex life, everything looks better on the outside. So I think they go hand in hand for sure.
Yeah. And I also, I wanted to take a step back, and I think it's really important for women to congratulate other women, right? You have done an amazing job in your career. You're a mom to two beautiful children, right? It's like we try to wear a million hats, right? Be the
Right.
best wife, be the best mom, be the best provider, be the best
Yeah.
everything, right? We're so anal and oh so ACD,
I know.
OCD. So really about giving women encouragement, whether they want to be a stay-at-home mom or whether they want to be an entrepreneur, physician, like really owning that and understanding that we can wear multiple hats and still be great at everything.
Right. Yeah. I mean, I think we've entered a new era, really. Like back when I was a resident, it wasn't quite as women friendly, right? To have children while you're in training and that sort of thing. So that's why I ended up doing IVF later on. But I really think we're in an era where it is celebrated. Women are CEOs, they're entrepreneurs, they're recruited by Galderma, Allergan, look at the leadership in these companies. So I think it is okay, and you can do those things that you want to do. And I know, I mean, you get to a point where you're an overkill. Like you can't do everything and do everything well. I tell my mentees that or residents, you can do it, but you can't do 100% and do 100% well. So you really have to pick your passions. And if you want to be a mom too, obviously that you can absolutely do that and do it on your own time frame, not on your boss's or someone else's time frame.
Yeah, I think that comes down to feeling like we need to be perfect. There really is no such thing. Look, we can be great. Does not mean that we don't make mistakes, does not mean that we don't falter, does not mean that we can't do better, right? But we just have to keep pushing forward and really, like you said, like pick your top three things that you want to be really good
Yeah,
at and spend your
right.
passion and time with and allow the other things to kind of take that background.
That's true. That's right. I think I have found in my career, I mean, I've done a lot, been there, done that. I practiced in New York City, but I find when you put your family first, everything else seems to kind of fall in line. Like rather than if you were to put your finances first, or you're putting I'm going to say it like your husband or your boyfriend first. Like I think when you put your children, your family first, then everything else kind of tends to go because you have the right kind of goals and values in place, I think.
That's that mama bear coming out on you.
That's true. That is true.
I
That's
can
right.
see that. But I think most of us are like that, right? We're so protective. And we try to do a really, really good job. And again, I think in our career path, particularly in plastic surgery, right? It is a male dominated field, and all of our fields, I think it's mostly male dominated. And I think we've done pretty well in holding up our own. And again, I just love to continue to encourage women that there's no ceiling to what we can do and continue to move forward. What kind of advice would you give to even practitioners maybe going into this field and what they should expect?
Well, I mean, I think with age of social media, I think people think it's really easy, like to just become like I'm going to go to like an associate nursing college and become an injector, and I'm going to have a practice like the day after, and I think that's set up for a lot of problems, including patient safety issues. And so I think in the medical spa industry, it's hard work, and I think you need to go about it in the right way, and have a broad basis of training, like yourself. You have a medical doctorate. I mean, you've seen the worst of the worst coming through in an emergency fashion, right? So an emergency when you see it. So a retrobulbar hematoma or blindness after filler isn't going to freak you out. If you saw it, you'd know how to handle it. And so that's what impresses me about you. But I think the people that are on Instagram, their practices are not as good as you probably think. There's a lot of smoke and mirrors and aesthetics, and it takes hard work. And like hard things are hard, and this is something that takes work. And when I say work, that's not like a weekend course or 12-month course. It's year in and year out. I think it takes years to become good at what you do. Just like a pilot you want your pilot when you go fly from New York to LA or wherever to have a certain number of thousands of hours. And I think the same thing should be for sure for plastic surgery, but also for aesthetics and injecting.
Yeah, I agree. Look, when we take the oath of being a physician, it's do no harm, right? It's really making sure that we know the medicine, that we know the risks, that we can really give an amazing treatment to a patient. And I agree, they think aesthetics is anybody could put a needle in someone's face and it's going to be okay. But there really is a concept, and there's an education and a platform, and it is not an overnight skill in any fashion.
The facial anatomy is so intricate and like exquisite and beautiful, but for someone who's never seen it, like I, for one, if I have a open brow lift or open facelift and I have a new esthetician or a new injector, I call them over and they have to come to the OR and look at what the anatomy, what do the transverse corrugators look like? What does the frontalis look like? Where's the division in the frontalis? I make them look at it because how could you inject if you don't know the facial anatomy? That's it's totally scary. And I think you being in Florida, no knocks on Florida, but like with plastic surgery too, there's so many unqualified practitioners, like in Miami, for example, for Brazilian butt lifts, that they had to create laws about it and for patient safety protection. So I think there's also just like absolutely unqualified people that aren't even nurses or doctors doing it too. So we have to educate the patients.
Yeah, look, it's really about education. It's really about timing, right? And practice. Like you're never good at anything. I think we used to have this little funny saying, everybody puts in that they're a master injector, which I
I
think is funny.
know,
And when you look up
everyone.
master injector, yeah, it means you have to have 10,000 hours of
Yeah,
service. And
like
I
the
laugh and
pilot.
I go, that takes about 10 years when last
That's
time I
right.
checked.
Yeah, just like the pilot example. Like, yeah, but if you look, I guess anybody, the thing to the layperson understand is like anybody can write anything on your Instagram profile. I could get on there and write,
Yes.
I'm the chief of surgery at Cornell. But I mean, am I? No, I'm in Austin, Texas. But anybody can write anything. So you just have to really kind of do your due diligence, I think.
That's right. So let's say do your due diligence, make sure you're going to a good provider, look at everything that they've been doing, look at their educational profile, and just stay safe.
Yeah, check your for board certification. Check for state licensure in that field, nurse, whether it's a nursing license or doctor, medical license.
Yeah. So you kind of have, I'm going to give you our last question. And this,
Okay.
this really kind of works for both your plastics and your med spa and your combination. So what does beauty mean to you?
Oh, that's like a hard question,
It
actually.
is.
Let's see, I'll just like start talking. No, so beauty. What does beauty mean to me? I mean, I think beauty is something. Gosh, there's like a Facebook post right now. Like I'm going to go back to social media where it's a really, really, happy, really nice woman of color, but everyone was commenting really rudely about her online. And it's beautiful though. But now, like she said, I'm keeping this picture up, you assholes, because I'm beautiful and I'm emoting beauty. And it's true. I think beauty is a self-concept we have inside, and we can emote that beauty. Like I can sit here if I didn't have my Botox in my lower face and have a resting, bitch face. I could sit here and really, and you'd be like, God, she's not looking. But beauty is subjective. It's in the eye of the beholder. So I could sit here and be very unhappy and not as beautiful as I'd like to believe I am with all of whatever I have in my face, Botox, filler. You have to emanate it from the inside. And that means you have to be happy, right? And so what does it take for us to be happy and beautiful? And then I think it just takes maintenance. Like we do our hair, we get our hair highlighted, we get our nails done. And people think plastic surgery or what you do is a one and done, and I'm not coming back for 2 years, and then they're mad when they have to. It's like, do you get your brows done like once a year? Do you get your hair done once a year? It takes maintenance and it takes commitment. And the internal part, what we were talking about earlier, the medical wellness part takes maintenance as well. And so I think it's in the eye of the beholder. I think it's something that we feel on the inside that we can project outwardly. Ideally, and then I think it takes work and maintenance too. Is what I tell my patients. Like it's not a one and done.
Look, everything is maintenance, right? From our diet to our health to aesthetics. There, you can't get out of maintenance, but feeling happy within definitely will illuminate your look when you're actually
Yeah.
expressing yourself and is how
And
you
Jen
feel. I
goes,
love that answer.
yeah, I mean, I think that takes like, what does that look like, doctor? Well, I think that takes like, what is your priority? Is it really coming to work and doing another breast augmentation? Like, I won't be on my deathbed saying like, God, I wish I'd done that last breast aug. It's really about like, are you taking a little bit of time to go see your children play their games because they won't be doing that forever? Are you taking time to travel? See the world, because you're not going to be on this earth forever. So those are the things that make me happy, and that's where I have to prioritize those. But I think those in the end are make me kind of a better, more beautiful person, definitely more well-rounded person, and more well-traveled.
Well, that's what I'm working for. I'm doing that 80/20 rule of trying to say no 20% of the time so that we have that time. For me,
Yeah,
traveling gives me peace, right? Being with my family
right.
gives me peace. And so I totally agree. I think we need to take
Yeah.
that time for ourselves, which we're not always so great at least I
No.
am not.
No, I've had to
Um,
work at it. I've had to work at it like, like working on going to church. I've had to commit to it, right? Because we so fall back into that routine. I think of like, well, I've got to be the one to answer this email. I've got to be the one to be on this Zoom. So, but that's kind of I think a flawed way of thinking. I try to teach my own staff, the staff that are kind of managing, and any like resident fellow that comes here, the art of like delegating. Like Warren Buffett said, one of the most powerful things you can do as a leader is delegating, right? And knowing how to do it right properly, but or whoever, what I just think delegating and knowing how to do that is a very important skill for leaders.
I love that. So stay vigilant, stay happy, and delegate as much as you can. I
Yeah,
love that. Well,
that's right.
thank you so much. I know
Thank
you're
you
really
for having me.
busy, and thank you for being on the podcast. You were such a pleasure, Dr. Walden, and we wish you
Thank
the very,
you.
very best.
Okay, have a great day.
You
Bye
too.
bye.
Bye.
Powered by Formula Wellness.